Hi viewer, welcome to my homeopathic medicine channel. Today I describe about fracture homeopathic treatment. Viewer, it is very important that when a bone is broken, the most important thing to do is keep the bone in fixed position. If the bones seem more or less in the right position, it is better not to move them. This could do more harm than good. If the bones are far out of position and the break is recent, you can try to set or strengthen them before putting on a cast. The sooner the bone are set, the easier it will be. However, this is very painful. Immediate first aid in homeopathy, while arrangements are made to remove the costly to hospital. Treat the patient, not the disease. Homeopathic treatment: shock, nervous reaction, physical reaction, pallor, cold, sweat, dizziness, nauseous. We give aconite 30, 1 dose at once and 2 to 3 times more if needed. For bruising, aching pain, injury to muscle and soft tissues, we give arnica 6, 1 dose after aconite and then every half hour. You may give arnica and aconite alternately for 2 or 3 doses. Home treatment after hospital treatment. For bruising, arnica 6, 1 dose twice a day. Stop with improvement. To strengthen the bones, calcarea phosphorica 6, 1 dose a day for 2 months. For bone pain, along the bone or at the site of the break, Ruta 6, 1 dose twice a day for 2 to 3 weeks. To speed healing, Symphytum 6, 1 dose twice a day for 2 to 3 weeks. Was the injury caused by bad fall or a road traffic accident? The patient knocked unconscious even briefly. Patient pale, sweaty, dizzy or faint. Injury to the pelvis, thigh or back. The limb cold, blue, tingling or numb. The limb bent, cracked, deformed or not usable. Do not let phone for ambulance now. Hospital, accident and emergency department. Thank you for watching my video. For regular update, like, comment and subscribe my channel. Thank you.